Welcome to this explainer. Today we're exploring a condition that's honestly just as deeply fascinating from a biological standpoint as it is complex for the millions of people who live with it every day. We're looking at multiple sclerosis, or MS. Now, at its absolute core, MS is really a story about a breakdown in communication. It's a chronic autoimmune disease affecting the central nervous system, which means the brain, the spinal cord, and the optic nerves. Just think of those three parts as the ultimate, highly sophisticated command center of your entire body. So here's the big question we really have to ask ourselves. What actually happens when that body's communication highway just breaks down? What happens when those flawless, lightning-fast messages zipping from your brain to your hands, your legs, your eyes suddenly hit a massive roadblock? Well, to truly understand multiple sclerosis, we've got to look really closely at that exact disruption. Okay, let's dive into this. In this explainer, we'll be covering 1. Understanding multiple sclerosis. 2. Causes and risk factors. 3. Types, symptoms, and relapses. 4. Diagnosis and medical treatments. And finally, 5. Living well with MS. We're going to zoom all the way from the microscopic level right out to holistic patient care. All right, moving into section 1, understanding multiple sclerosis and the microscopic breakdown. Because to understand the disease, we really have to understand the biology first. So the absolutely crucial point here is understanding the substance called myelin. Think of the nerves in your body kind of like the electrical cords plugged into your wall, right? Those electrical cords are wrapped in a protective rubber or plastic casing, and that insulation is there to keep the electricity flowing straight to your lamp or your TV without leaking out. Well, myelin is your body's biological insulation. It's a protective coating wrapped right around your nerve fibers, and its entire job, literally its only job, is to make sure electrical signals from your brain travel perfectly and incredibly fast to their destination. Now, when we compare healthy nerves to what medical folks call demyelinated nerves, the contrast is pretty stark. In a healthy nerve, that myelin coating is totally intact. The signals are fast, efficient, you want to move your hand and boom, instantly your hand moves. But with MS, that myelin gets damaged. When this biological insulation is stripped away, a process called demyelination, those nerve signals get slowed down or even blocked completely. It's essentially a biological short circuit. And that short circuit is exactly what directly causes the neurological symptoms of MS. Let's move on and see how this builds through a very specific chain of events. MS is fundamentally a massive autoimmune mistake. Step 1, the body's immune system basically gets confused and mistakenly launches an attack on its own myelin. Step 2, this attack causes severe inflammation, basically swelling in the brain and spinal cord. Step 3, that inflammation leads directly to the demyelination we were just talking about. Step 4, as those damaged areas try to heal themselves, they form stiff scars, which are also known as plaques or lesions. Fun fact, sclerosis actually translates to abnormal hardening or scarring. And finally, step 5, this scarring leads to permanent nerve damage, completely disrupting that vital communication between the brain and the body. Let's jump to section 2, causes and risk factors. We're shifting focus from how this happens to the why and the who. Now, the exact singular cause of MS actually remains unknown. It's kind of like a giant puzzle. But medical science has identified this web of interconnected factors that increase the risk. There are genetic factors. Having a family history definitely plays a role, though actually, scratch that. It's not strictly hereditary in the traditional sense. There are environmental factors too, like a lack of vitamin D, smoking, or even certain past viral infections. Demographically, we also see that the disease most commonly presents in young adults, right between the ages of 20 and 40, and it generally affects females more frequently than males. Ultimately, it's likely a combination of all these elements triggering that autoimmune mistake. I actually want to pause here for a second and emphasize this next point very clearly, just to dispel a really common persistent myth. MS is indeed one of the most common neurological disorders in young adults, but it is absolutely 100% not contagious. There is literally no way to catch multiple sclerosis from someone else. It's entirely an internal immune-driven process, definitely not an infectious disease you can spread from person to person. All right, moving into section 3, types, symptoms, and relapses, the clinical picture. Because those frayed wires can happen anywhere, the disease really does look totally different for everyone. Now, what's really interesting about this slide is how the disease actually maps out onto specific paths. The vast majority of patients start out with what's called relapsing remitting MS, or RRMS. This basically means they experience attacks where symptoms flare up, followed by periods of recovery or remission where the disease just kind of goes quiet. But contrast that with the progressive forms. Secondary progressive often develops later on from RMS, where symptoms gradually worsen without those clear recovery periods. And primary progressive? Well, that's a gradual worsening right from the very beginning. By figuring out which category a patient falls into, doctors can better predict the disease's behavior and, most importantly, tailor the treatment. Grouping the symptoms like this really helps us logically understand the immense physical and, honestly, the emotional toll of this disease. Early or common symptoms might actually be totally invisible to other people. Things like crushing fatigue, blurred vision from optic neuritis, or this strange numbness and tingling in the arms and legs. But as those nerve signals face more and more roadblocks, advanced symptoms can emerge. We're talking profound muscle weakness, severe balance loss, difficulty speaking or even swallowing, and incredibly challenging cognitive changes, including memory problems, anxiety, and depression. It really does affect the entire body. For patients and their caregivers, knowing exactly what constitutes an actual attack is absolutely vital for managing the condition. A relapse isn't just feeling a little extra tired one afternoon. Medically speaking, a relapse is defined as the appearance of totally new symptoms or a very clear worsening of existing ones that lasts for more than 24 hours. That 24-hour mark is key. It's the hallmark of active disease in relapsing remitting MS. Now, while a lot of symptoms are managed over the long haul, it is incredibly critical to know that certain things require immediate medical intervention. If someone experiences sudden vision loss, severe and sudden weakness, any difficulty breathing or swallowing, or an abrupt inability to walk, these are red flags. They're emergency warning signs. They signify a major, severe disruption in the central nervous system, and they need to be evaluated by a healthcare professional immediately. No waiting around. Okay, let's lift the energy a bit as we head into Section 4, Diagnosis and Medical Treatments, Finding Answers and Solutions. This is where modern medicine fights back. First off, diagnosing MS is basically like putting together a really complex puzzle. There isn't just one simple blood test where a doctor can say, yep, you have MS. Instead, neurologists have to use a combination of tools. They take a super detailed medical history, they perform neurological exams, they rule out other diseases with blood tests and spinal taps. But the absolute most crucial puzzle piece, the MRI scan. An MRI actually lets doctors peek right inside the brain and spinal cord to visually detect those scars, those lesions, where the myelin has been damaged. And this brilliantly illustrates how, once diagnosed, doctors tackle MS from two very distinct angles. On one hand, we have the long game, disease-modifying therapies, or DMTs. These are drugs like interferon beta or ocrelizumab, and they work to modify the immune system to slow down the overall progression of the disease and prevent future attacks. On the other hand, we have the short game, corticosteroids. If a patient is having an acute, severe relapse right this second, doctors use heavy-duty steroids to rapidly cool down that massive inflammation and speed up the recovery process. Which brings us to our final section, Section 5, Living Well with MS, Management and Adaptation. Here, it's all about agency and treating the whole person. You see, treating MS isn't just about popping pills or taking medications. It's about proactive management, adapting to changes, and treating the human being, not just the biological disease. A massive pillar of this is physiotherapy. Physiotherapy acts almost like physical armor against the progression of the disease. By working with specialists on stretching, strength training, and gait training, patients can directly fight back against that muscle stiffness and weakness. The specific goals here, like improving balance and preventing falls, they all serve one master objective: giving patients the techniques they need to maintain their independence and keep moving safely. And beyond physical therapy, comprehensive care really surrounds the patient with support. Occupational therapists step in to help patients adapt their homes with special equipment to make daily life much easier. Speech therapists help out with any swallowing or speaking issues. But I want to enthusiastically point out that everyday lifestyle choices matter immensely too. Getting regular exercise, eating a highly nutritious diet, managing your stress, prioritizing sleep, and keeping those vitamin D levels up, these aren't just nice-to-haves. These lifestyle choices are powerful, vital tools that actively reduce complications like chronic pain and depression. They work hand in hand with the medical therapies. I really want to focus on this quote here because it is the absolute core takeaway of everything we've looked at today. Many people with MS live productive and fulfilling lives. Early diagnosis, modern treatments, healthy habits, and medical care can help people maintain independence. Obviously, an MS diagnosis is a major life-altering event. There is no sugarcoating that. But it is definitely not the end of a fulfilling life. The combination of early intervention and comprehensive modern care changes the trajectory entirely. Which leaves us with this final, really exciting thought. We know how to slow the attacks down now. We know how to manage the symptoms. But with medical research advancing at just an unprecedented pace, how close are we to a world where the body's communication highway can completely rebuild its frayed wires? Could remyelination therapies be the next great medical breakthrough? Thank you so much for exploring the science and the deeply human impact of multiple sclerosis with me today. Stay curious and keep learning.